Hi guys, my name's Macy. I'm a student at Texas Lutheran University taking medical terminology, and I'm going to give y'all my take of mental health in the language of psychology and psychiatry. Just some general abbreviations related to mental health. We have the PhD, doctorate in philosophy, the PsyD, a doctorate in psychology, MD, Doctor of Medicine, and all of these kind of collectively use the DSM, which is the Diagnostic Manual of Mental Disorders, which is the kind of the governing thing that mental health care providers use to diagnose and treat mental disorders. We have GAD is General Anxiety Disorder, PTSD, Post-Traumatic Stress Disorder, OCD, Obsessive Compulsive Disorder, and BPD, Borderline Personality Disorder. And in the middle we kind of have the American Psychological Association, which is the governing kind of body of ethics and research methods of psychological care. Mental health is defined in our textbook as emotional, behavioral, and social well-being for individual coping methods and with internal and external events. Practitioners of mental health are psychiatrists and psychologists. Finally. Psychiatry is more of kind of the clinical setting and the more of the diagnostics. They're licensed physicians, they have an MD, and are licensed to prescribe medications. Psychology is more of the scientific study of behavior and mental processes. They do more experiments, and they monitor mental processes about our experiences. In psychotherapy, they communicate with us and try to treat. They're not licensed physicians, and they cannot prescribe medications. They both kind of try to accomplish the same goal, is to treat mental disorders, which are anything that causes a person to suffer from emotional distress, the condition that prevents people from taking care of themselves, inability to work or to interact socially, and produces self-destructive tendencies such as substance abuse and self-harm, and endangers themselves and the community as well. We're going to start with types of mental disorders. Mood disorders, depression and bipolar, just kind of a lot of deep sadness, people feeling helpless and worthless, but bipolar is more of kind of both sides of being very overactive and distracted. The manic state, people don't sleep, and untreated phases go for about 6 weeks. And then the depressive phase is excessive sadness. They'll sleep a lot, pretty much the exact opposite of the manic phase, but when they happen at the same time, they tend to last about 3 or 4 months. And on the left, we have the sad girl who's just kind of like, I know exactly what she's feeling, and I interpret it this way of her, like just kind of like seeing all the life just kind of like pour out of her. And then I have your SpongeBob meme in the middle. And then bipolar is kind of showing more of the depressive more than the manic. Moving into anxiety, we have general anxiety disorder, post-traumatic stress disorder, and panic disorder. Generalized anxiety disorder doesn't focus on one kind of fear. They develop nervous habits like tapping, insomnia, bad concentration, and they get irritated very easily. PTSD is more extreme distress after they have sustained a significant trauma. Panic disorder is sudden random attacks of intense fear, rapid onset, and then they peak at about 10 minutes. Panic disorder is also hereditary. We don't know why. Phobias are small dangers, and the person knows that they're irrational or silly, like the fear of heights or fear of a confined space. Social phobias of being afraid to be embarrassed in public, like stage fright, public speaking. OCD, people have to go through checklists, they have to count, rearrange things in a like certain way, their way or the highway type of thing. Moving into schizophrenia, they have far less brain activity than we do. We can see here on this CT scan right here, there's far less brain activity. The red over here signifies lots of brain activity, and over here we have far less in the temporal lobe, and they're more separated from reality. Their words have no meaning. The thought processes don't involve behavior. There's very high difficulty of concentrating. Hallucinations often occur, and they hear voices that tell them to do things. They suffer from delusion and paranoia on an extreme level. Moving into personality disorders, borderline personality disorder, affected people are impulsive, emotionally unstable, and manipulative, and then in a split second they're happy and content, and then in another, they are angry, irritable, and sarcastic. And they're very insecure and have low self-worth. This leads to self-destructive tendencies, self-injury, suicide. And the importance of mental health in the healthcare field, we need to bridge the gap. The patient needs a well-rounded care. They need to be diagnosed mentally and both physically of something that's going on. And mental illnesses prevent people from living a full life. If something's wrong in the brain, then it's often affecting something else, such as having a panic attack. It's something that causes lots of hyperventilation. They're shaking, speaking personally, and how can a person exist like that if they're not treated? Because it's also affecting the respiratory system, and we really need to bridge the gap between physical care and mental care. Thank you.